The Ritshidze project reported on the state of the public health system in Gauteng. Gauteng is one of the provinces that lags furthest behind in reaching the UNAIDS 1990 targets. Gauteng's progress was 89, 66, 88 by the end of 2019, translating into 66% and 52% of people living with HIV receiving antiretroviral therapy. To tell us more, we're joined on the line by Ritshidze Project Officer Belinda Sitsogelo. Belinda, very good morning to you. Thank you so much for your time. The target that has been set, the 1990 targets, the province is lagging behind. What are some of the reasons why?
Good morning to the listeners, and thank you for the opportunity. So one of the problems that the report has alluded to is the long waiting time in the facilities, it's the attitude of the nurses, it's the shortages of medicines that patients often encounter when they go to the facilities, whereby they are sent back with either 2 weeks or 3 weeks supplies of medicine.
As you speak about the attitude of nurses, I mean, that speaks to a very important element. Exactly what do you mean by the attitude of nurses?
Okay, so you're aware that the department have launched a welcome back services, whereby if a patient have missed their appointment, when they get back to the facility, what needs to happen is that they need to be sent for an adherence counseling. But as a result, that is not what is transpiring in the facilities. 56 of patients that were surveyed in the first quarter of the Ritshidze project reported that when they've missed their appointment, they have been reprimanded. Some that say that they've been sent at the back of the queue, irrespective of what the reason they've missed their appointment. So those are the attitudes that makes patients not to want to return back to facilities.
Another concern that has been earmarked here is the initiation of treatment and the interruptions of treatment. Talk to us a little bit about that.
So the interruptions of people on treatment unfolds in several ways. Since the enrollment of DTG, people have been switched without their consent on treatment. And whenever there are issues of shortages of medicines, people are switched forth and back between whatever treatment that is available. And people are somehow given short supplies of treatment. That also causes a problem. And the fact that people are not informed, they are not knowledgeable about the kind of treatment that they take, that also makes people not to feel that they are responsible to take the treatment that they are given.
And what will it take? I mean, you conducted this research, you conducted the numbers, and as you concluded the scope of the work, what were the opportunities that you saw that could take the province forward and the country forward when it comes to commemorating and marking World AIDS Day and making sure that there is indeed some improvement when it comes to access to ARVs and the treatment of those with HIV?
Okay, so what the PLHIV sector has concluded on, which are some of the demands that we've outlined, and part of this report is that the government needs to release a provincial human resource plan that includes a provincial list of how they're going to fill in all the current vacancies that they have in the province. And they also need to make sure that they prioritize additional staffing in the next financial year and make sure that the circular of May 2019 of extending working hours in facilities is followed up and implemented, because at the moment it's just a circular or is a policy in paper. It is not resourced, it is not taken care of, and nobody is following up on it. And they also need to make sure that they ensure that all facilities have resources and equipment for to improve the healthcare provision in the facilities.
Belinda, as you launch this detailed report in the state of the public healthcare system, how much of an impact did COVID-19 have on the outcome of your results?
So the pandemic also took a toll on the healthcare system that was already weak, because as a result of the COVID pandemic, we've lost a lot of people on care, mainly because the government does not have a system that is centralized for people to get their treatment. For example, a lot of people had to leave Joburg, the city, to go to the villages, and when they get there, they could not access their treatment because they are not on the system. There is no a centralized system. So people kept on being sent in forth and back. You must go back to your initial clinic to get a referral letter that is sending you to our clinic, and that is very problematic. If the system was centralized and people were just had an identifier code, it was going to be easy because they'll just punch in the code and then people's information will show up and then people will receive treatment.
And as you conducted this research and collected the numbers, what sort of demographics were you looking at? Give us a sense on the breakdown of those demographics.
So the project in Gauteng is looking at the 4 districts, which is Ekurhuleni, it's looking at the city of Joburg, it's looking at Sidibeng, and it's looking at Tshwane. And we are looking at about 123 Putuma supported facilities.
And very lastly, before we let you go, as you conclude and get some sort of direction on where the province is going with accessing clinics and the public healthcare system in the country, the crisis that it faces, what sort of advice would you be giving now to government officials when it comes to ensuring that there is focus on HIV treatment and access, as well as TB, to ensure that the numbers are reduced and that the targets that have been set are indeed achieved?
So I think on our side, it will be re-emphasizing the demand for resources for health. That would also mean the strengthening of extending the refills of chronic medicine supply to about 3 to 6 months, and also the functionality of the adherence lab and the community pickup points, because there are programs that are aimed to decanting patients from the facilities. However, they all seem to be fading away. Another point is the replacement of staff. The report also shows that there is a lot of vacancies, ranging from staff, from professional nurses throughout the province. That needs to be prioritized, and those positions need to be filled. Because some of the reasons that the staff are burnt out, they are frustrated, they end up showing their frustrations to the patient is because some of them are working under pressure, are working understaffed.
Very well. Thank you so much for your time. We're going to have to leave it there for now. Ritshidze Projects Officer Belinda Sutugelo